Hello, my name is Paris Foster. I am 28 years old. I am a mother, a wife, and a registered nurse. I have been providing bedside care as a registered nurse for 4 years. I am currently applying to Jacksonville State University BSN to DNP program. This is my career box. I will be using it to help illustrate my nursing journey. Let's begin with my education, where I attended college. I attended Troy University from 2007 until 2012. I graduated from Troy University School of Nursing in Troy, Alabama in December 2012 with a BS in nursing. I began practicing under a temporary license, and in February 2013, I became a licensed registered nurse in the state of Alabama. Now let's talk about my employment history, where I have worked. My first job as a registered nurse was at Vaughn Regional Medical Center in Selma, Alabama from February 2013 until February 2014. At Vaughn Regional Medical Center, I worked on the medical intensive care unit and the critical care unit. While working at Vaughn Regional Medical Center, I gained a year experience on the intensive care unit. After working there for a year, I relocated to Birmingham, Alabama, and I began working at Brookwood Medical Center. I worked on the medical surgical infectious disease unit from February 2014 until July 2015. While working at Brookwood Medical Center, I had the opportunity to precept newly hired RNs to our medical surgical floor. It was a great learning experience for me. Although I was the preceptor, it reminded me that you can take different routes to arrive at the correct answer for nursing. In July 2015, I took a different nursing avenue and began working as a charge nurse at Golden Living Center, a skilled nursing facility. I worked at this facility from July 2015 until December 2015. As a charge nurse at Golden Living, I was responsible for staffing, scheduling, resolving conflict, and promoting patient and staff satisfaction. In December 2015, I went on maternity leave to birth my beautiful baby boy and returned to the workforce in February 2016 at Grandview Medical Center. I work on the pulmonary medical surgical floor at Grandview Medical Center. I also work at St. Vincent's Hospital, downtown Birmingham campus. I began working at St. Vincent November 2016 on 7 Main, a medical surgical floor. I'm still currently employed part-time at Grandview Medical Center and full-time on weekends at St. Vincent's Hospital. Now let's discuss the roles of an advanced practice nurse. The American Nursing Association states that advanced practice nurses play a pivotal role in the future of healthcare because advanced practice nurses are often primary care providers and are at the forefront of providing preventative care to the public. Listed here are some of the roles that I believe an advanced practice nurse should carry. Provide primary care, such as in clinics, private practices, or hospital settings. For example, in the hospital setting, I see many advanced practice nurses become the first care provider for many patients by establishing a rapport. They obtain the patient's background and they obtain the patient's medical history. And many of the advanced practice nurses in hospital settings establish and initiate the patient's plan of care. An advanced practice nurse should also provide preventative care by raising awareness and educating the public and other members of healthcare about disease processes. Advanced practice nurses are also patient advocates. They do this by ensuring patients are treated appropriately and free from harm and or danger. Advanced practice nurses also collaborate with the healthcare team by communicating with the entire healthcare team about the treatment plans for patients and sick individuals. Advanced practice nurses also serve as case managers by coordinating long-term care for patients to keep them healthy in and out of the hospital. Advanced practitioner nurses should also work as educators by educating patients, the public, and other healthcare workers to improve medical practices. Lastly, let's discuss my future goals and endeavors. I am from a very small rural town in Marengo County. I grew up in Stafford, Alabama, where the population is 642. I would like to practice and one day hopefully establish a private practice in a rural community to offer access to healthcare to individuals in rural areas. People in rural areas sometimes do not have the resources as in more urban areas. Because this is so, they tend to not have regular checkups, especially the elderly population. I would like to prevent high occurrences of terminal illnesses in this community of individuals. By the time they go to the doctor or hospital, their illness has become terminal. Sometimes this can be prevented through regular checkups and physicals. I also plan to become a nurse educator. I have a passion for teaching and mentoring future nurses. I believe outstanding healthcare begins with the people who provide it. I would like to be a part of creating exceptional nurses by combining my nursing knowledge, my nursing experiences, and my love for nursing. This concludes my nursing journey. Thank you and have a blessed day.